Sarah?
All right, Steve, thank you. In today's Health Watch, you may think of mental health as an adult issue, but a new report says thousands of children in the district who need help with mental health issues aren't getting any assistance. So what kinds of mental health problems can children face, and how can we best address them? Joining us now is clinical psychotherapist Cindy Crane of Cindy Crane Counseling to talk more about this. Thank you so much.
Thanks for having me.
This is such an important issue when we see the thousands of just children in D.C. alone that are suffering. What is it that's behind this? Why so many children in D.C. that are suffering?
You know, I think that there is an ongoing issue where when there is a large group of low-income people, services are not reaching them that they really need from every level, but particularly around the mental health area.
Mm-hmm. What kind of things are we seeing in these children? What types of mental health issues, like depression? Are there other things? What are we seeing?
Yes, we're seeing depression, anxiety, a lot of trauma, and then ADHD is a common one. But really, I think a lot of these issues emerge from families where there is maybe not enough to eat on the table, maybe there isn't enough childcare at home. Certainly, children who are hungry are going to have different stress issues when they try to go to school and learn, and it can be overwhelming.
Mm-hmm. So I can only imagine, but talk about the risk factors specifically, so people can kind of maybe prevent it before they see it going down that road.
Yeah. Risk factors, I think, include just coming from a low-income housing situation, not having enough adequate parental care, maybe stressors going on in the house, having a teenage or unemployed parent can all be factors where there's any kind of substance or alcohol abuse in the family that can exacerbate symptoms that can appear as mental health problems, and if not treated, then become disorders.
Now explain to me, what are the difference between the two?
Right, yeah, and I think it's important to notice. I mean, people can be very anxious and have troubles with that, but once it becomes a disorder, it's really, I see that as it's getting in the way of your life. Mm-hmm. And this is something that's going to a higher level of function that is maladaptive and needs to be treated either with medication and or treatment, but also an awareness at the first point from the people who are going to see this child first. Their teachers, for example, might notice it.
Mm-hmm. So what types of treatment, I mean, at what point do they need to start getting treatment? I mean, is it something that can happen and they can go on to lead normal, healthy lives? Give me an idea there.
You know, I think we say with anyone across the board, as soon as we start to see mental health symptoms, the sooner that you treat them, the better the outcome will be. And many of the disorders we see across the lifespan do begin in childhood. So we want to start noticing symptoms early, treat them early, and maybe they won't become a disorder. It just sort of depends.
And maybe given, since the teachers, like you mentioned, spend so much time with the kids and also family, what should they notice first off, like withdrawing? What kind of things are these kids doing?
Yeah, I think first of all, we need to probably have a much broader training for teachers and others who are interacting with these students throughout the day to recognize certain symptoms, but symptoms of a child, withdrawing, getting more quiet, becoming more introverted could be a sign, as could the opposite be true, acting out, becoming more verbose, being angry, pushing other children. Anything that is abnormal for that child or that it seems like a red flag. The other thing is kids will say if they're very unhappy, that they may think about hurting themselves.
Oh, and we hope it does not go down that road, of course. This is such a big issue that I'm glad we are talking about, that we need to shed more light on, of course. Cindy Crane of Cindy Crane Counseling, thanks for coming in and talking with us.
Thanks for having me. And I do want to say, it's Mental Health Month. May is Mental Health Month, so I really appreciate that we're looking at this issue this month.
Absolutely. Thanks again, Cindy.
Thanks for having me.
Back to you, Steve and Allison.
Thank you, ladies.